Profhilo, some people say Profhilo. These and other injectable, what we call skin boosters, are what I'm going to explain today. Profhilo is one of the most talked about products. Let's find out exactly why. What is it doing to faces to make it that way? One key thing to understand is facial volume, or fat in the face. Fat in the face makes people often look younger and lifted, but it has to be placed correctly. We all know fat in some areas makes us look older, but Profhilo and these skin boosters, they actually create some volume that is different than fillers, and I'll tell you about that today, but that's why they create youth and people like them. Some people call them injectable moisturizers, and we'll look at some before and afters as well and the results so you know what you may expect. Cost, longevity, let's cover that. And at the end, I'll give you my take on should you get this product and maybe a couple alternatives to think of. So this new wave of hyaluronic acid products, including Profhilo, have formed a group of advanced aesthetic treatments known as skin boosters, which are soaring in popularity with both actually men and women. Unlike typical dermal fillers, they're employed for hydration over large and major contouring.
What do I mean by that? Well, if you look at this picture, you see a very well contoured cheek, lips with projection. That's not what skin boosters are all about.
Key point, because we're seeing a lot of people overdone, strong jawlines, you think big lips.
Forging a new path and taking the heat for all of it.
Big cheeks, especially that anterior cheek, and a lot of people don't like that. There's a kickback, a movement away from that, which is why we see dissolver clinics. These products are very different from what they do, as we'll see in the pictures. Traditional fillers give you that wham, these do not. Injectable moisture treatments like these and dermal fillers, they're both made of hyaluronic acid. That's the water binding molecule that you guys know well that can hold up to 10,000 times its weight in water. It's actually a natural component of your skin right now, whether you take it or not, it's in there. But as we age, the bodies produce less and less of it. So these skin boosters aim to replace some of that. Hyaluronic acid is made up of these long chains. And when you get a filler, these are cross-linked hyaluronic acid. Okay, so it's cross-linked to be stable, more stable in the body. The body doesn't want to break it down. Profhilo and these skin boosters, they lack the cross-linking. So they have more of a boosting effect than a filling effect. Now, note here, the topical that you apply, that you get, that you put on a product, and sometimes it will have hyaluronic acid with, say, argireline in it, those are not meant to be injected. They're much different as well. So you have three: the topical, the skin boosting type, and then the filler type that are cross-linked. Understand that. But some of these skin boosters, in a very cool way, have other additives. And I'll talk about some as well that have different additives, like even vitamins, amino acids. So they're really meant to boost the skin. Profhilo is especially popular in countries outside of the USA. And I've used it to inject and, of course, put it myself. I put it in my forearm just to see what it would do, how long it would last. That's an old school way that we used to look at fillers. Just put them subdermally in the forearm. And I did try it. I put it there. I don't have it in my face, but in the UK and now Australia, they're very popular. So how is it applied? Some do put a little numbing cream on first, and then it involves having the injections placed in 8 strategically placed areas on what they say the lower face. What they mean by that is they don't often use it in the upper face. I'll tell you about that when we talk about complications. But in the lower face, it's like a little bee sting, little swelling around the sites. Much like when you get Botox or neuromodulators, they last 24 hours or less. These are softer products, so they can be just kind of smushed around. You can massage them around. Now, they have strategic locations advised, and you can see in this chart what they're talking about. But of course, they can be put anywhere depending on where your provider feels placement is best. And that's why the consult is key. Many people even use them in the arms, around the arms, the legs, the knees, and on the body. So they can be used there. Let's look at these before and afters.
So if you look at this first picture, you'll see there's less crepiness, there's a little more volume. Understand, nothing was put in the lips with Profhilo here, but it's overall tightness, overall rejuvenation, maybe a little bit more glow. And you have to decide for yourself for a few $1,000s if that is worth it. Next, we have one of the neck. Now, the neck bothers people. Understand, you see those bands, it will not remove platysma bands, but this will be an optimal result of the neck of a few sessions. And again, it's mainly addressing the crepiness, but you have to be a candidate. There are no deep lines, there are no deep neck bands, and of course it won't change any coloration. Here we have an arm, and the same thing. It's the crepiness of the skin that is improved. Now, if you look at this picture, there's an angle issue here. So the after picture, the face is more tilted up. There's a little more lighting. I wouldn't expect that you get a lot of this kind of lift with this product. This is an optimal result, but understand there's a little more glow, a tiny bit of lift. The jowls are still there. And if you look at the picture in the after, there's a little more distance. So you're seeing the patient further away. You get a little less of the fishbowl effect. So there's a little trickery here. It is very difficult to get perfect before and afters. Typically use 3D imaging, but you get an idea of just a little more glow. And again, a couple sessions, you're going to repeat this every 6 to 9 months or so, and you have to determine if the cost of $2,000 to $4,000 every year is worth it for that type of result. For some, they love that. It's all they're looking for.
Now, here's something you often hear. They say, reassuringly, there are no other negatives to Profhilo other than those beast things I talked about. Is that true? No. Anything you inject is dangerous. Anything you inject has risk of occlusion, of infection, of not looking good, of lasting longer than you think and less than you think. So all of these things can do that. And I think anything with a particle size particularly can cause blindness. Now you might say there are no cases of it. And this could certainly be true, but it doesn't mean it can't cause it. It's all about risk stratifying. Even if it's 1 in 100, 200,000, the risk is there. It's just small. And these have less risk of complications than your regular fillers. How many sessions are needed? 2 sessions are recommended about 6 weeks apart. And most people see the best results at about 3 to 4 weeks after their second session. Sound familiar? Same thing we do with the blood draw like Para. Same thing we do with things like Sculptor. Now, when I say 2 sessions, if you're smoking, drinking, partying, you're not sleeping, you're not exercising, you might need 3 or 4 sessions. If you are taking care of your skin, you're using great skincare, you're not getting a lot of sun, often you might even benefit from 1 set of injections. Let's talk cost. You're all wondering. So the average cost for a single injection session is $600 to $1,000 US. And then, so if you get 2 sessions, of course, you could be up towards $2,000. Sound familiar? A facial rejuvenation procedure, in my opinion, everything's about $5,000 now. By the time you get a little resurfacing, a little neuromodulator like Botox and Dysport, a couple of sessions of Profhilo, maybe a chemical peel, there's $5,000. If you're maintaining, of course, you can just pick and choose as you go along. But someone who hasn't done anything or their skin's not in the best of shape, $5,000 and up to $10,000 for minimally invasive is pretty standard now. What are the benefits? Well, plumping of the skin, as we said, nothing like regular fillers. It gives a significant fuller yet tighter look, so people see tightening. The smoothing of the crepiness, just a more youthful look, and a glow. So it makes your skincare and everything work better. And that's the big catch to these products. Let's see what the company says about the product. Let's look at that and debunk that a little bit.
Let's look at this from the company. So safety has been a top priority in the development of Profhilo, which is clinically tested and shows, here's the problem I have, no negative side effects. So I'm not dissing this, I'm just telling you what I look at when I read an article. No negative side effects. Absolutely everything has side effects. Understand that. No such thing. Only the purest and best hyaluronic acid is biofermented to create Profhilo. There are absolutely, look at this, no chemicals or additives, which reduces the risk of side effects. Okay, so by nature of making hyaluronic acid, there are chemicals involved. Understand that. The every 2 ml dose of Profhilo is loaded with, this is a high amount, 64 milligrams of 100% pure synthetic HA. Now you can get pure HA, but look at this. Remember, there were no chemicals, yet it is synthetic. So by nature, you see the trickery in the words. You have to understand that when you read these things. The highest available concentration on the market, correct. Additionally, it is biocompatible, so it will not cause any harm to the skin tissue. You cannot say that. That's untrue. And again, I'm just telling you what goes through my mind when I read it for the first time. Everything great can cause harm. Just understand that. The stabilized skin bio-remodeling serum lingers for approximately 28 days. So now we know. You know how filler lasts 1 to maybe 10 years plus? They're telling you that it lasts 10 days. So the effect of whatever you're getting must be longer from a stimulating kind of a mechanism, which is exponentially longer than non-stable topical injectable formulas. So that means non-cross-link like fillers. They're non-stabilized. And this differs it from skincare, okay? The user-friendly treatment plan includes 2 short, now painless, of course it's not painless, you're getting a needle put in your face, a 31, 32 gauge needle. So you have to understand this would never pass the US FDA wording. During treatment, Profhilo is slowly injected with, this must be a mistake, 10 syringes, and there is little to no risk of bruising. Well, certainly there is a risk of bruising, guaranteed. When you put a needle in the face, there just is that risk. 5 injection sites are specially planned for each side of the face. So I think that's where they came up with the 10. There's 10 injection points. Different anatomical regions. Patients primarily report lifting and skin texture improvements across the cheeks, lip area. So I haven't seen it used in the lip. Lip area would be like the barcode lines or vertical lip lines, and the chin. And those are the key areas to use it. In addition to the face, it is also used for the neck, décolletage, hands. So there is a different kit for body. So you can get a different kit which has higher number of syringes and volume, as you might suspect, for the body.
So you have Profhilo. What is its competition? Well, certainly Profhilo, it is the biggest buzzword in terms of its name, but many cosmetic practitioners work with a product called Volite from Juvederm. That might sound familiar because they also make, of course, Botox. Then you have TEOXANE REDENSITY 1, Belotero Revive, Restylane Skin Boosters, which in the United States is called Restylane Silk. It's been here for a while, and there are 2 strengths of that in some countries. A lighter version and a more thicker one. In the United States, it's known to be used for perioral or even lip filler for hydration, but it is skin boosters in other countries. So it's repurposed in a sense. Some of these contain additional skin nutrients, promising to work on the condition of the skin. So from the inside out. And that makes sense intuitively, but there are no real good studies to prove that those additives like vitamins and amino acids do a lot, but it does make sense. So if you want to go that route, it's worth trying. Volite from Juvederm has lower levels of hyaluronic acid than Profhilo and TEOXANE REDENSITY 1. It doesn't contain minerals, vitamins, or antioxidants, so it only moderately hydrates the skin. It's from Vycross technology, but it will last longer. Profhilo is actually pure hyaluronic acid in very high quantities, so it's meant to bio-remodel that collagen and elastin while hydrating the skin. That's a company claim, but I've yet to see a good study to back up that it builds collagen and elastin. In the category of studies, Sculptor still wins out. It is proven to build those elements. And we do that through staining studies looking at collagen and for many elastin. Now, I mentioned earlier that the injection points for Profhilo are in the lower face. Could it be used in the forehead? Can these be used in the forehead? Yes, they can, but the arteries and the veins communicate in the forehead, and the risk of occlusion and particularly blindness, because the veins, it's a little complex here, but the veins communicate with the arteries. The retinal artery is the one you worry about. I know a lot of people are going to ask, can you use it in the forehead? Because the forehead ages so many of us, especially if you're thin. There's very little fat here. It's precious fat. And it's why I don't RF or RF microneedle the forehead. So they can be used in the forehead. We divide the forehead into thirds because the vasculature is different in the lower third than the upper third. So you really need to know someone who's well versed in anatomy, but they can be used in the forehead. Whether they have these amino acids in them or not. But keep in mind, Profhilo certainly has a high, thick concentration of hyaluronic acid in that sense. If you're thinking TEOXANE Redensity 1, it can be used all over the face as a full hydration treatment, and it combines pure hyaluronic acid with 3 antioxidants and 8 amino acids and 2 minerals and a vitamin. So if you want to go that route for skin boosters, that might be the way to go. It repairs the skin while hydrating it. Think of that. And think of the old mesotherapy treatments that I have many videos on. It's a little more to the side of mesotherapy, where we inject in the middle layer of skin nutrients for rejuvenation of the skin and vitamins. So that would be the one there. Now, 100% all natural now exists, and you need to be aware of that in plasma fill from platelet-rich fibrin, which is your own blood draw. There's no additives, no hyaluronic acids. It's your stem cells and your exosomes. You spin the blood to purify those. So think of that as well. A lot of people don't want foreign things injected in them. So you go to plasmafill.com with one L. plasmafil.com if you want to see all natural treatments, or look on my videos on this channel, because those are true skin boosting elements as well. There's so many options here. I hope that helps. There's a complete video up here on things you can do at home. Keep your skin and body beautiful, healthy, and vibrant.